So we are here today to talk about the potential for social media in healthcare. And I am Maya. I do the web communications for NAPH, for those of you that I have not met yet. After this, I would appreciate anybody coming up to me asking me questions about using social media for themselves, for their hospitals, as well as our new NAPH member community that I hope you all have signed up for outside. So hospitals are turning to social media more and more to better connect with patients, with their staff, and with the larger community. And the benefits of that can range from everything from better customer service triage to improved communication with reporters, to sharing critical information. And earlier from some of our other speakers, we heard how dire that need is, how few Americans really understand the Affordable Care Act, and what role we can play in helping educate people and advocating for better services for our hospitals and for the patients that we serve. So today I have Chris Boyer from Innova Health System in Virginia, and he is the Director of Digital Marketing there. He's going to talk to us a little bit about the ROI of social media and some of the use cases that they've shown successful at their health system there. And Bob West is from SUNY Upstate Medical University in Syracuse. He is actually a professor, teaches budding docs, and is a molecular biologist by trade. So I'm actually just going to turn it over to them, let them get straight away.
All right, hey, we're the last presentation of the day, so we'll try to be a little exciting for you. My name is Chris Boyer, and I'm with Innova Health System. We're a 7-hospital not-for-profit system in Northern Virginia. We're not a public hospital, but I've been asked here to come here today to talk a little bit about how you could tap the power of social media in your hospital systems to better reach out to your stakeholders in your community. So let me try to do it. There we go. This is really what we're going to learn today. So how social media is different than other forms of marketing and communications that are out there. We all hear about social media, but how are these things different? We're going to talk about online communities and how those are important and how those are really important advocacy groups for you to tap into, to discuss, and reach out and share your knowledge and your information through them. We're going to talk about ROI of social media. A lot of people don't think there's ROI in social media. Well, there is, and I'm going to share some examples of that with you. And then lastly, I'm going to talk about some tips on how to build a good social media strategy for success. And then I'm going to turn it over to Bob, and he's going to blow your mind with what he's going to talk about. So for those of you in the audience that are in social media and like to Twitter, the hashtag is NAPH, pound NAPH. We're live streaming this on the web too, so hello to everyone out there that's tuning in. Bob, I, and Maya, we're all members of the Mayo Clinic Center for Social Media. That is an international organization that's dedicated to helping educate hospitals and health systems on how to use social media to more effectively address their needs. And it's across a variety of different things. So we all know each other. We all work together in this large organization. So let me ask a quick poll for those of you out there right now. How many of you have or use for yourself or your hospital, and we're just going to raise hands here, Facebook? Okay, for yourself and for your hospital. Hospital. Okay, just hospital. Okay, Foursquare for yourself, okay. Twitter for yourself and for your hospital. Okay. YouTube. Okay, YouTube for yourself and your hospital. LinkedIn. We all should have a LinkedIn account, right? And how about a blog? Have any of you blog? Okay, good. Some of you do blog. Okay, great. Well, you're not alone. In fact, in the world, 1 out of every 13 people in the entire world have a Facebook page. Think about that. 700 million users are on Facebook. That's huge. YouTube is the second largest search engine in the world. The number 1 is Google. Google owns YouTube, by the way, so think about that. People spend an average of 15 minutes a day on YouTube. I admit, I spend about that much on YouTube. Yeah, that's true. Okay. Twitter. 13% of all online adults in America are on Twitter. And that number has doubled in the last year, and that number is continuing to increase. And then lastly, LinkedIn. 44 million users in the United States use LinkedIn. And 17.8 million users are in actually these LinkedIn groups. Okay? Quite a bit of people. Here's how the hospitals rank. Ed Bennett, another member of the Mayo Clinic Center for Social Media, he's up in the University of Maryland Medical Center up in Baltimore, he actually keeps track of how hospitals are using these different tools. Does this surprise you? Look at that. 79% of all hospitals surveyed have a Facebook account. Now, if his poll is a little bit smaller, it's 909 hospitals, so it doesn't reflect the larger group, but still. Foursquare, 76%. Twitter, 74%, and so on. You could see we're not alone in using these tools, okay? Everyone's using these tools, but why are we doing this? Where do I point to click this here? It's not advancing here.
Yep, that's the one.
I'm not getting an advance. Can you advance the slide for me, please? Maybe. There we go. Why are we doing this? Now, this is called the social media Lotus. This is something that goes up online and updated every month. And every month it shows the variety of new social media sites that are out there. And when I look at this, I am scared because I, as a communicator and a marketer and responsible for my health system, I don't know what to do with this. This is way too much information, and it's almost information overload, and we're already dealing with information overload. How do we fix this in social media? Whoops. Well, let me tell you something. Social media is not like any other form of marketing, so don't be worried by that slide. And I'm going to talk about how social media is different with my first myth. Here's the truth. This is a Facebook page of the Facebook page that sparked the Egyptian Revolution. These are the tweets that occurred the night that President Obama went online and said that Osama bin Laden was killed. Now, the last bump over there is when he announced it. I knew Osama bin Laden was killed about an hour before on Twitter. I don't know if you guys have heard of United Breaks Guitars. You may want to go out there and Google that. This is a guy, a musician, who watched United Airlines toss his guitar, and then he asked United to replace the broken guitar, which they wouldn't, and he wrote a song that has now over 10 million views on YouTube. And then, of course, do we have to talk about this guy, right? Social media is different than marketing and communications. It's changing the way we communicate with people, with our stakeholders. And let me tell you a little bit about how it's different, because when I first started doing social media, I looked at it as another marketing tool, and I didn't understand it. Well, sure, I was doing it, but I didn't really understand it. So I turned to the most prominent resource online to give me the authoritative definition of what social media is: Wikipedia. And that's what Wikipedia says. I'll quote it. Social media is a blending of technology and social interaction for the co-creation of value. What does that mean? Can any of you tell me what that means? I don't know what that means, but I'm going to define it a little bit differently for you here today. Social media is really, this is my definition, it's about two-way participation. No longer is it us talking to people and they listening. It is now us talking to people and they talking back to us, and sometimes they talk to us first. And sometimes they say things like, in my hospital, a tweet that occurred at 11:50 a.m. in the morning: "What is wrong with people? Someone stole a baby from a Nova Fairfax hospital." I got that tweet, and I called my hospital, and I asked them, did someone take a baby from a Nova Fairfax hospital? Because someone tweeted it. Well, it ended up, good news, we were drilling. It was a code pink. We were drilling for that. And the lady misheard it, misinterpreted it, and tweeted it out to her 3,000 followers on Twitter. So I had to intercede into that conversation and start to converse with her and let her know that what we were doing is safety. It was really a safety tool. And we actually ended up, that was a good success story for us. But still, two-way participation. It's user-generated content. We don't create the content anymore. It's about transparency. Okay, the boundaries between us, our hospitals, and the community, and our stakeholders, the physicians, and whoever else is using social media, it's gone now. People are talking about their healthcare online, and they can. We can't, right? So people complain about their stay on Facebook. We can't get in there and say, well, really, we actually treated you well. We have to take that conversation offline, because people are allowed to share their health information online. They're not restricted by HIPAA, but we are. It's about credibility, because if you're out there participating in social media, you're actually being more credible to your communities, to your stakeholders, than you are to anyone else. And lastly, it's about trust. If you're not on social media these days, people don't trust you. They just don't trust you. They do it through online communities of interest, but I'm going to jump to the trust factor, because I think trust underlies and underscores one of the most big problems with most hospital marketing efforts. This is my rant. I like to rant when I'm on stage. I hope you don't mind. We position ourselves wrong to our community. We like to think that people come to our hospital systems because of our products, our new robots, our new technologies, our new processes, our new towers. No, they don't care about that. Or maybe they come to us because we give good service, right? It's great patient care, good bedside manner. We have good patient satisfaction scores. Maybe we won a couple of quality awards. No, people don't think about hospitals that way. All people really fundamentally care about hospitals is if they come to you, that they can trust you. They don't want to come to your hospital unless they believe that you're the most effective to address their problems. And quite frankly, the majority of the people driving by your hospital during the day and seeing your hospital sign, they're whispering under their breath a prayer that they don't have to go to your hospital. That's the difference that we have to face as hospitals in this world, is people don't want to come to us. So what we have to do is we have to build trust with these people, and social media allows that, because it's really this thing what I call the continuum of I don't care. See, most people don't care about us as a hospital. They don't. They don't care about our issues, our problems. They don't care that we are dealing with ACOs, that we're dealing with, healthcare reform. They don't care. It's only at a certain point in time do they actually really start to care about our hospital, and it's usually when their loved one or they themselves have some kind of medical event. And then, and only then, do they really start to care. And then after that medical event occurs at their hospital, they go to your hospital, they have surgery, or they have their loved one treated there, then they have an opinion about you. Now, you have to remember this when you're talking about social media, or you're not going to succeed. The great news about this, no, they don't care, right? They don't care. They care deeply. And what's scary is these people over here that care deeply about you, and they usually either really like you or really don't like you, those people share their opinions and influence the people that don't care about you. And social media provides us a forum now where we can start to talk to these people at all different levels, all different mediums, all different areas of their caring process. And we have to learn how to communicate to them differently. So to those people that don't care, you have to give them stuff that they care about. They don't care about ACOs. They care about the fact that if they get sick, heaven forbid, that there might be a hospital nearby for them. But they don't research that hospital until they get sick, or until they think about getting sick. So, how do we address that? We have to create a social media plan. This happens to be a picture that I drew on my whiteboard when I first started. This is ANOVA's social media plan. Okay? It's pretty impressive, right? What I did is I had to make sure it was aligning with our marketing and communications plans. I had to define the role of the social media tools to communicate at the right time to the right people in the right way. I had to be relevant, and I had to create a policy that my executives would care about. See, because CEOs don't care about social media either until they get a tweet that says their hospital sucks.